My name is Heather Membretti. I'm a physician assistant working in rheumatology for the last 9 years. I currently live and work in a suburb of Houston, Texas.
我叫做 Heather Membretti， 我喺過去9年都係從事風濕醫生助理，我嚟自德薩斯州侯斯頓。
I just again want to welcome you here. Thank you for attending the program on behalf of GSK, Lupus Research Alliance, and Rheumatology Advanced Practice Providers.
我好歡迎大家參加我哋今日紅斑狼瘡共存嘅重要信息。我想代表風濕資深醫療專業人員協會、紅斑狼瘡研究聯盟同埋葛蘭史克歡迎大家。
Our slide deck today was prepared by a colleague of mine, Monica Ritchie, who is a nurse practitioner working in rheumatology here in New York City.
今日嘅講座係我個同事 Monica Ritchie 寫嘅，佢係 Northwell Health 醫療風濕部擔任執。
Today's content and the materials were produced by RAP in consultation with Lupus Research Alliance and Lupus Therapeutics. The material here is for educational purposes only and should not take the place of guidance from your medical providers. Comments made today may not reflect the views of either of these organizations, and both of the organizations maintain editorial control of materials that are published.
今日講座內容係風濕資深醫療專業人員協會同埋狼瘡研究聯盟一齊制定嘅。今日嘅教材只係供教育嘅目的，唔取代專業醫生嘅專業意見。今日任何評論都唔反映我哋嘅觀點。我哋兩個組織都堅持最高嘅道德標準，並保持對所有發布嘅教材同埋編輯保持控制權。
Our program today is sponsored by GlaxoSmithKline.
係多謝葛蘭史克公司今日贊助呢個講座。
And our program is being held in collaboration with Hospital for Surgical Specialty and VNS Health.
係我哋嘅講座亦都係紐約特殊外科醫院嘅紅斑狼瘡亞裔關懷聯盟同埋富康醫療社區中心合作。
So the biggest question on everyone's mind when I talk to a patient who is newly diagnosed or who is coming in for follow-up with lupus is, what is this disease process? Lupus is a complex autoimmune disease that has the potential to affect virtually all organ systems. Symptoms can come and go, be waxing and waning. They can be mild, moderate, or even life-threatening if not treated appropriately. For many patients with lupus, symptoms that you may be experiencing may be somewhat invisible to those around you, and nobody can really understand, because they cannot see the symptoms, what you're experiencing internally. There is a hereditary component to the risk of developing lupus. For example, you're at much higher risk of developing lupus if you yourself have a first-degree relative in your family who has also been diagnosed with lupus. Lupus is not a contractable disease. You cannot catch it from someone in the community. You cannot transmit it to someone in the community, and it is not cancer.
當我同狼瘡嘅病人傾偈嘅時候，都會被問到，究竟乜嘢係紅斑狼瘡啊？其實狼瘡係一種好複雜嘅慢性自身免疫系統病，可以影響每一個唔同嘅器官。系統性狼瘡嘅症狀來去不定，佢亦都會喺唔同嘅時間發作或者消失。如果治療不當，症狀可以輕微、中度，甚至危及生命。對於外界人士、朋友、家人、同事嚟講，狼瘡嘅症狀的確係好陌生，佢哋冇辦法睇到你入邊承受緊呢種病係點樣承受法。有一個遺傳性嘅，當你嘅近親有紅斑狼瘡嘅時候，你患狼瘡嘅機率又會提高。狼瘡並唔係傳染病，你唔會喺人哋嗰度得染狼瘡，你亦都唔會將佢傳俾其他人。紅斑狼瘡亦都唔係癌症，絕對唔係癌症。
Just briefly, more than welcome to take notes or pictures, but this slide presentation is going to be available accessible. So don't worry if you can't get everything.
Heather 小姐話呢個講座完咗可以印俾大家嘅，你哋可以剔筆記，剔唔到都唔緊要，會同大家分享。
So I like to describe lupus as sort of the perfect storm in terms of the factors at play for developing lupus. There is definitely, like I mentioned before, a genetic risk component. There are sex hormones at play, specifically estrogen. And we can see in our patient populations who become diagnosed with lupus, it is much higher prevalence in women of childbearing age. In fact, the incidence of lupus is a 9-to-1 ratio affecting women to men. There are certainly environmental factors that can play a role in development of symptoms of lupus at onset. Some of these triggers in terms of environmental factors may be medication exposure or potentially certain stressors, life stressors, for example.
紅斑狼瘡有人描述為一場完美嘅風暴，因為佢有好多唔同嘅因素引致。頭先講過遺傳係其中一個因素啦。具體嚟講，你近親友，你有嘅機會亦都高。另外就係性激素有關，特別係雌激素，係一種荷爾蒙嚟嘅。狼瘡對生育年齡嘅婦女影響係特別高。如果女性同男性相比，女性嘅比例係9:1。雖然我哋仍然需要進行更多嘅研究揾出嘅成因，但係某些藥物或者壓力等等都可以誘發狼瘡，喺疾病發展中扮演一個好重要嘅角色。
So one of the things that we worry about in terms of system being affected by lupus is lupus nephritis. And this is a process by which your immune system actually begins attacking your kidneys. For patients diagnosed with lupus, approximately 1/3 of lupus patients may have this process affecting their kidneys at the time of their diagnosis. Your highest risk for developing lupus nephritis is typically within the first 10 years of your course of the disease. And we know that in general, lupus disproportionately affects Asian Americans, African Americans, and Hispanic Americans compared to Caucasians at a much higher rate. This is also true for the incidence typically of lupus nephritis. I will say one thing for the incidence of lupus nephritis in men, even though I mentioned lupus in general is much more prominent in women compared to men. For those patients with lupus nephritis who are men, I will say it will disproportionately affect more total percentage of men with lupus, if that makes sense. Their survival rates for patients with lupus nephritis vary according to the number of years you've had the disease process, but I will speak a bit of optimism here in terms of treatments coming out now and in the future. We have great optimism in terms of expanding the survival rates for patients living with lupus nephritis. One of the questions that I have come up almost every time I speak to a patient about the development of lupus nephritis is, why can't we treat this with medication? Why do I need a potential renal biopsy? And the answer for that is because they have to correctly identify the class of lupus nephritis that you have so that we can target the correct treatment. And this is essential because the treatment of what dose of steroids you need, or even any immunosuppressive therapy choices that we make, will depend upon the classification of lupus nephritis obtained by a kidney biopsy.
好啦，狼瘡性腎炎咧係一個常見嘅症狀，佢涉及你嘅免疫系統攻擊你嘅腎臟。幾乎1/3嘅系統性狼瘡患者都會有狼瘡性腎炎。喺確診之後頭10年內咧，你患上狼瘡性腎炎嘅風險最大。狼瘡一般係唔成比例咁樣影響到亞裔、非裔同埋西語裔嘅美國人。更加重要嘅就係同白人狼瘡患者相比，狼瘡性腎炎喺有色族裔嘅人發病率係高啲嘅。好似我剛才所講，影響女性、男性嘅狼瘡發病率係9:1。 男性患者同女性相比，患狼瘡性腎炎嘅風險更高。狼瘡性腎炎嘅存活率取決你確診咗狼瘡有幾耐。喺樂觀嘅角度嚟睇，隨住新療法嘅出現，我認為我哋可以大大提高系統性狼瘡嘅存活率。臨床上經常遇到一個問題就係，點解我哋診治狼瘡性腎炎一定要去做腎活檢？點解唔可以就咁醫呢個病？實際上，腎活檢係為我哋提供有關你狼瘡性腎炎嘅類型同埋級別，呢啲係好重要嘅信息，因為根據呢啲信息，我哋可以知道用邊一種免疫抑制劑，同埋使用幾多類固醇嚟引導我哋嘅治療過程。呢個係唔可以少得嘅部分。你特定嘅狼瘡性腎炎嘅級別，對我哋確定正確嘅治療方案至關重要。
Get into the treatment of systemic lupus. So the whole goal is in treating lupus is to help maintain disease stability and reduce your risk or frequency of flaring of your disease. We will intentionally sometimes suppress your immune system in order to do this, to reduce the burden of the lupus disease for you, and then to prevent secondary complications affecting your organs in terms of bone density loss that can happen from steroid use, and also things like kidney failure related to lupus nephritis.
狼瘡嘅治療實際上咧，主要目的就係要維持你嘅疾病嘅穩定性，同埋降低你發病嘅風險。我哋會抑制你嘅免疫系統去控制狼瘡，而且減少狼瘡對你其他器官嘅影響，嘗試預防併發症，例如骨質疏鬆症啊、腎衰竭啊，對一啲尤其是對狼瘡腎炎嘅患者，呢啲重要嘅，非常重要。
Here you see the history of lupus treatments becoming available. We like to call the lupus arsenal, okay? Dating all the way back to the late 1890s when we began using quinine. In the 1950s, we began using different types of corticosteroids like prednisone. In 1955, there was the advent of hydroxychloroquine or Plaquenil. And then in the 70s and 80s, we began using immunosuppressive medications like azathioprine and methotrexate. And then the most exciting period for us in the treatment of lupus has been in the last 10 to 12 years with the advent of biologics like belimumab in 2011, rituximab, anifrolumab, and voclosporin, which is the bottom there.
嗱，你大家睇到呢個我哋嘅治療方案叫做狼瘡兵工廠，所有我哋嘅藥物喺度。歷史可以追溯到1890年，我哋第一次用桂寧呢個藥嚟醫狼瘡。1950年，我哋開始用皮質類固醇或者叫撥利松。1955年，我哋就開始用興氯貴，佢而家係我哋狼瘡標準第一線藥物。70年代、80年代，我哋開發咗免疫抑制劑，例如硫唑嘌呤或者甲胺嘌呤。90年代，我哋開始用揮芬酸酯治療狼瘡性腎炎。2011年開始，我哋開始用貝利木單抗、利妥式單抗、voclosporin 同埋 anifrolumab 呢啲生物藥劑。
The past 10 years, 10 to 12 years in the treatment of lupus have been really exciting. It's revolutionized our options for treating patients with lupus and really improved quality of life. Belimumab, also known as Benlysta, was first approved for adults for treatment of lupus in 2011. It was actually approved in 2019 for the treatment of children over the age of 5 with lupus. And in 2020, belimumab was approved for patients with lupus nephritis who are adults. And then in 2022 is approved for children over the age of 5 with lupus nephritis. Anifrolumab, which is also known as Safnello, was approved for treatment of systemic lupus in 2021. And voclosporin, known as lupkinase, was also approved specifically for lupus nephritis in 2021.
過去10年咧， 我哋狼瘡治療令人非常振奮，因為隨住2011年狼瘡治療生物化劑首次開發，徹底咗改變咗我哋對狼瘡患者嘅治療選擇，意義重大。例如貝力木單抗，亦都叫做 Benlysta， 喺2011年首次批准用喺成人狼瘡患者，然後2019年獲批用喺5歲以上嘅兒童，2020獲批成人狼瘡性腎炎，而喺2022年亦都可以用喺5歲以上嘅狼瘡腎炎兒童患者。另外一隻藥叫做 Anifrolumab， 亦都係叫做 Sothnello， 係喺2021年被批准於用喺系統性狼瘡治療。而 Voclosporin 亦都係叫做 Lopkinase， 喺2021年被批准用喺治療狼瘡性腎炎患者身上。
So in my day-to-day role with patients, this is my passion of helping patients understand what it is we need to do to treat their disease and why we may need many medications. The disease of lupus is so unpredictable and everybody's experience is unique that we oftentimes will incorporate multiple medications to treat your disease process. The symptoms are complicated. They can come and they can go. We can have lupus affecting one organ system or many organ systems at different times. Most of our patients with lupus will require more than one medication to manage their disease and prevent organ damage, secondary complications. And of course, throughout the whole process, we want to prioritize discussing side effect profiles of all the options of medications.
喺我哋同患者日常討論中，成日被問到一個問題就係，點解我哋要食咁多隻藥呢？我哋唔可以用一個療法嚟控制呢個病咩？答案係否定嘅，因為呢個係一個好獨特嘅疾病，佢唔可以預測，症狀可以起伏不定，佢亦都影響到每一個器官，或者以後會牽涉去其他嘅器官，因此單一藥物通常係唔夠治療呢一個病嘅。同樣，我哋嘅目標係要防止疾病影響其他器官，所以我哋必須仔細選擇適合你嘅療法，屬於你個人嘅藥物治療方案，並必須討論藥物嘅潛在副作用。
One of the things that comes up in many discussions with my patients is this frustration with the medication regimen. And if you have lupus and you're experiencing that sense of frustration, know that you're not alone. This is an important aspect of shared decision-making that comes into my day-to-day work with patients. First of all, please do not stop taking your medication, even if you feel like stopping, before you talk to your medical provider. Try to have an open discussion about finding options that can make adjustments that make it work for your lifestyle. When I talk with patients about this, we look at whether we can discontinue maybe certain supplements, change their medication regimen so that they're not taking multiple pills a day. Maybe they take one pill a day. Change the route of administration of some of your medications. For example, belimumab, Benlysta, can have an administration in the IV form, or it can be administered in subcutaneous injections at home. I ask patients to try changing the format of their medications from IV to injection to oral, looking at things that make it workable for their lifestyle and their priorities.
當患者知道要食咁多隻藥、咁多個治療方案嘅時候，不免會感到好沮喪，而且好多時患者都想放棄或者停止服藥。我同狼瘡患者嘅討論入邊就涉及到我哋嘅共同決策。我中意同我病人了解佢哋嘅方案對佢哋嚟講係咪可以持續嘅？點解佢哋會覺得有困難？我了解咗之後，我就可能會提議，或者你有啲維他命補充劑係唔需要食嘅，可以免除啊。亦都可以每日服一次藥，唔需要每日服多次藥啊。亦都或者可以，譬如 Benlysta 呢啲係由靜脈注射嘅，改為喺屋企注射。呢啲方法都有可能減低佢哋嘅日程安排，令佢哋個負荷減低。我可以嘗試優先考慮合適患者嘅生活方式嘅養生法，嚟對 疾病保持控制。
The side effects of our lupus treatment regimens vary significantly. Many of our immunosuppressive medications can increase risk of infections, cause concerns for infertility side effects, skin discoloration or hair loss. I'm going to pick on prednisone a little bit here for a moment. Prednisone is usable for patients managing flares of lupus, and sometimes it's a necessity in our treatment regimen, but it can lead to multiple side effects, including loss of bone density, like osteoporosis, increased rates of infection, avascular necrosis, which is loss of blood supply to a bone, increased risk of diabetes, high blood pressure. I think Jennifer mentioned earlier the sensation of bloating, sometimes insomnia, many things to consider there.
治療藥物副作用嘅範圍好大嘅，我有好多免疫抑制劑會增加患者感染嘅風險，亦都會導致生育嘅問題，亦都會增加脫髮或者皮膚變色嘅風險。譬如皮質類固醇，佢係控制狼瘡必須嘅藥物，但係佢亦都帶嚟一啲令人厭惡嘅副作用，包括糖尿病風險升高啦、高血壓或者缺血性骨頭枯死嘅風險。呢個係同骨組織同埋骨骼嘅血液供應喪失有關，亦可能會有骨質疏鬆症，亦即係骨嘅密度流失，亦會影響你消化能力，影響你夜晚失眠。
So at this point in the discussion, I want to turn and let members of the audience contribute. I want to know, given this chronic autoimmune disease, all the treatment options out there, I want to know how you individually with lupus have learned to live well with this chronic disease process. We heard from Jennifer about diet changes she made, increasing her activity levels. So I want to hear from members of the audience. What have you done in your life to live well with this disease?
好啦，我而家想停一停，反問我哋嘅聽眾，你點樣同呢個慢性病相處㗎？你個人狼瘡嘅經歷得到控制嘅時候，有啲乜嘢你覺得係有用嘅，可以同大家分享啊？一兩樣嘢你覺得可以同大家分享嘅，請你提出嚟。
Sure.
Definitely lower my living stress,
Stress reduction.
and eating better. And right now, that's what I'm dealing with.
Good. Anybody else?
呢位朋友話，我有兩樣嘢幫到我。第一就係減輕我自己嘅壓力，第二食好啲。
Anyone else have any thoughts to share?
有冇其他分享？
Yes, ma'am. So quick, direct communication with your healthcare provider to make changes in medication.
我個方法咧就係同我嘅醫生保持緊密聯繫。當我有啲唔妥嘅時候，我即刻同醫生諮詢，佢會將我個藥物改嚟適應我。Thank you.
Okay. In conversation, oh, yes, ma'am, please share.
我想問咧，你頭先講嘅血小板減少啊，
嗯
咁會唔會影響個傷口減少咗啦，好難好同埋流得多。
When you have low platelet count, how does it affect when you have wound or skin break?
So a low platelet count can put you at risk for increased risk of bleeding. Okay. So you want to make sure you're monitoring that with your healthcare provider. There's certain foods and other medications that can affect platelet count as well. So you want to make sure you're open communication about that. But in the form of showing up on the skin, most common symptom I see from my patients who have low platelet count is easy bruising, even things like bleeding from the gums, urinary bleeding. So those are all things we watch for with patients who have chronically low platelets.
當你血小板低嘅時候咧，個症狀第一就係好容易流血不止啦。咁通常咧，你要同你嘅醫生緊密聯繫，因為佢會話俾你聽有啲咩藥物、有啲咩食物會同你個血小板有抵觸。咁最常見，如果你唔係流緊血嘅咧，最常見嘅症狀就係你皮膚會有瘀傷，好容易碰瘀。
Okay, so one of the topics that comes up in discussions with patients on how to live well with the process of lupus is the idea of supplements. And I'm not a self-proposed expert in the area of supplementation, but I think the most important point here is that you need to have an open discussion and talk to your healthcare provider about everything that you're taking, including over-the-counter and herbal supplements, before you start taking them, to make sure there is communication about any potential interaction. Please avoid crazy cures on TV, on the internet. There is no cure for systemic lupus, okay? Don't fall for that. It is a requirement for treatment most of the time, and you don't need to fall for the quick cure claims.
係啦，咁同患者討論中咧，有陣時佢會問到我維他命補充劑，佢哋想話揾一啲可以緩解症狀嘅藥物。我雖然唔係專家，但係我要強調就係，當你開始服用某隻補充劑之前，你必須要同你嘅醫生商量，問過先至好開始食。原因係因為好多補充劑咧會引起藥物之間嘅不良反應，會有相抵觸。我希望你哋知道我希望身為醫療人員知道我哋嘅患者嘅真實情況，確保了解佢哋嘅實際病情。我想提大家，千祈唔好喺網上、喺電視揾一啲咩特效藥去醫治紅斑狼瘡，因為紅斑狼瘡係醫唔好嘅，所以一定要留意，唔好揾快速治療法。
I want to add something here from my own personal experience, not represented in the slide transcription, okay, is that there's a need for ongoing research about supplementation in lupus. In general, there is no regulation of what goes into the supplements that are out there to be purchased. So you have to do your research and make sure you're obtaining them from a reliable source. And in general, my practice of recommendation to patients for supplements that are safe and encouraged would be few things. Vitamin D3 supplementation, because many of our patients have vitamin D deficiency. Omega-3 fatty acids, a multivitamin, and then there was one other thing. You can go ahead.
Okay, 係啦，我想加一樣嘢咧，就係
So this is my personal recommendation, general recommendation to my patients. I can't speak for everybody.
嗱，呢個係我嘅個人個人嘅意見。當病者問到我應該服啲咩補充劑、維他命咧，我會 recommend 3樣嘢。第一，維他命 D， 因為好多時咧，我嘅病人都缺少維他命 D 呢個元素，對我哋嘅骨質啊，對我哋嘅抵抗力係非常有效。第二就係奧美加3，奧美加3呢個油咧，大家都知道對心臟好。第三 The third one is
I usually recommend vitamin D3 over the counter, omega-3 fatty acids, a multivitamin, and then the other one I had down was a B supplement, specifically B12, and Jennifer contributed a magnesium supplement at a low dose.
同埋多種維他命 B 同埋鎂 magnesium 鎂呢幾樣都係對我哋狼瘡比較好嘅。
You had a question, sir?
People taking cocosamine or CoQ10, are those dangerous?
So in general, those supplements are readily available. You mentioned CoQ10 and glucosamine. In my experience with patients, generally those are considered fairly safe. But I will say there's not a lot of reliable research out there to speak for or against them. And I ask patients to just bring all that to my attention so I can have that real life discussion with them. Yeah.
有位聽眾問 CoQ10 同埋 glucosamine 對呢個病有冇好處？阿 Heather 小姐話醫學對報告嚟講冇講佢唔好，亦都冇講佢好好，所以 up to 你哋個人嘅決定。
Yeah. Okay. So exercise, extremely important for patients with lupus. It can improve so many things related to quality of life. Getting more mobile can improve your levels and experience of fatigue. It can improve mood symptoms from anxiety to depression, cognitive function, memory function. It will help reduce your joint pain overall. It will promote weight loss. The motto in my clinic is that a body in motion stays in motion. Okay.
嗱，另外我想提咧就係運動，運動對狼瘡患者非常之有益嘅喎，佢可以提高你嘅能量啦，幫助控制焦慮、抑鬱，亦都幫助你提高認知嘅功能。佢可以減輕關節疼痛，並且幫助減體重。保持運動係十分之好嘅。我哋嘅診所有一個座右銘，就係身體移動，保持運動。
Next topic here is sleep. This is a non-negotiable for patients with lupus, okay? I tell patients in my office, this is not a negotiable thing to focus on. This is a priority. Sleep deprivation short-term, as many of you may know, you're going to get brain fog. You're going to have impairment in different things. You can actually put yourself at risk for developing obesity, insulin resistance, and heart disease from chronic sleep deprivation. The recommendation I give to my patients is at least 8 hours of quality sleep. Make it a priority. The most refreshing sleep you're going to get happens during the deepest phase of sleep, and that's where you have most of your restorative benefits.
跟住落嚟咧就係睡眠，冇得傾嘅，一定要有足夠睡眠。我經常去勸諫我啲病人優先考慮足夠睡眠，幫助佢哋控制呢個疾病。若果你剝奪睡眠，會導致你認知有障礙，各種短期嘅問題，長期嚟講咧，可能會令你變得肥胖啦、胰島素唔正常啦，同埋患心臟病嘅風險。我要求病人至少每日瞓8個鐘，最能夠恢復活力嘅時間就係發生喺深夜，當你深層睡眠嘅時候。請大家安靜少少嚇，請大家安靜少少，唔該你。Sorry.
The next component of living well with lupus is stress and management of stress. I think this is so important because we have to make a distinction between what is in our control in terms of stressors and what may not be in our control. Set our priorities to manage stress. I will pick on my females in the audience with lupus. In general, I think that women are typically caretakers, but I tell my female patients with lupus every day, you cannot take care of someone else if you are not prioritizing taking care of yourself first. Don't be afraid to ask people for help, involve your loved ones, make friends in communities. Like I want to say, especially Lupus Asian Network and the resources available here in New York City. You want to make friends and build those communities and network, meet other people going through a similar journey. And finally, learn to say no to things. Know that if you set your priorities and managing stress, it's okay to say no. I can't do this because I want to manage my stress and that I have to say no.
OK， 跟住我要講一樣好重要嘅咧，就係去管理個壓力。我哋經常病人同我哋講點樣管理壓力法咧？首先，你一定要知道乜嘢你能夠控制，乜嘢你係無法控制嘅。就你所經歷嘅壓力而言，你必須放棄嗰啲唔喺你控制範圍之內嘅壓力。好多時候，尤其是女性嘅狼瘡患者，佢哋通常都係照顧者，負責照顧其他人，佢哋唔會優先照顧自己。所以我想同我嘅女性病人講，如果你唔好好照顧好自己，你有咩方法照顧其他人呢？我鼓勵你哋同社區或者你支持系統中嘅親人朋友搜尋一啲支援同埋教育計劃，例如紅斑狼瘡亞裔關懷聯盟提供到嘅資源，同埋得閒可以出去做啲志願嘅工作，結識一啲同你有相同病歷嘅人。記住唔好害怕去揾求助，亦都唔好害怕拒絕會增加你壓力嘅義務。
One of the things that is very important for patients of childbearing age with lupus is the discussion around planning a pregnancy at a time when the disease is well controlled. I can speak for our clinic experience. We discuss with patients a period of at least 6 months, preferably 12 months of well-controlled disease or in remission before attempting to conceive and carry a pregnancy. This is because pregnancy risks increase for mom and for baby when the disease activity is increased. And generally, patients who are pregnant during a time of active lupus or lupus nephritis tend to have worse outcomes, including many pregnancy complications, pregnancy loss, growth restriction, preterm birth, things like that.
對於生育年齡嘅女性患者咧，經常講到個話題就係懷孕相關嘅事宜，需要了解呢啲重要嘅事項，咁樣會減少一啲不良嘅後果，例如早產啊或者早期夭折呢啲咁嘅問題，尤其是患有囊瘡性腎炎嘅患者。當你疾病活躍嘅時候，就會增加懷孕期間嘅風險同埋併發症。所以我會同我啲生育年齡病人講，懷孕之前，我希望佢哋嘅病情受到控制至少6至到12個月，咁樣就會大大降低媽咪同埋嬰兒嘅風險。
Along these lines, part of the shared decision-making that needs to happen is discussion about ways to prevent pregnancy until lupus disease activity is controlled. My recommendations for patients with lupus is to avoid systemic estrogen containing contraceptive pills, opt for something that's progestin only. We have the Depo-Provera option, Implanon, or IUDs.
係啦，喺同一個思路，我同我嘅女性病人討論避孕嘅方法，直到病情得到控制為止。我總係會推薦一啲唔含雌激素嘅口服藥物啦。囊瘡患者其他有推薦嘅咧，就叫做Implanon 或者一啲叫植入式裝置或者宮內節育器。
The area of interest for many folks is participation in clinical research. This is an important area for developing new treatments for lupus. And I will say a word here. We know that our Asian American population, African Americans, Hispanic Americans are disproportionately affected more often with lupus. And therefore, we want to have people from these communities well represented in clinical trials for treatment so that we can adequately take care of the patients that are most affected by lupus. It's important to have a wide range of folks involved. One of the benefits for many people participating in clinical research is access to top specialists. If you can't participate or for some reason do not qualify for clinical research, consider being part of a patient advocacy board. This is for patients with lupus. Research professionals come to you and ask for your feedback on development of clinical trials, educational materials, and it's another chance to get involved.
囊瘡患者有另外一個可以選擇做嘅事咧，就係參與一啲臨床試驗，甚至觀察性研究。呢個對於開發新嘅囊瘡治療同埋持續進程非常重要。我哋希望患者社群入邊，尤其是受囊瘡影響最大嘅亞裔、西語裔同埋非裔美國人，能夠喺呢啲臨床試驗中得到足夠嘅代表，咁樣可以幫助我哋改良未來嘅護理。除咗能夠參與研究試驗代表你嘅社區之外，參與研究試驗嘅患者通常會得到知名嘅專家頂級護理。如果出於某啲原因，你對參與研究試驗唔感興趣嘅話，你可以嘗試加入一啲顧問委員會，研究醫生團隊會徵詢你嘅作為患者對臨床試驗嘅意見啦，或者患者教材一啲新嘅試驗，請患者你哋提供意見。
And again, I want to pause and ask for some feedback from the audience here. How many of you have in your journey in rheumatology care had the opportunity to visit with a PA, a nurse practitioner, or even a pharmacist specializing in rheumatology?
好啦，我而家想請問大家聽眾，你哋有冇嘗試同一啲醫生助理、執業護士或者藥劑師交談過啊？有嘅請你舉手。
Anybody? Okay. So what is the difference here between folks considered advanced practice providers? Nurse practitioners are trained in a nursing model. Physicians and PAs are trained in an allopathic or Western medical model. And usually both nurse practitioners and PAs are collaborating, working with physicians we have to maintain at minimum a master's degree beyond a bachelor's degree.
嗱，乜嘢係資深醫療專業人員咧？我哋係一啲醫生助理啦、執業護士同埋藥劑師。我哋係一啲同你做倡導同埋俾資源你哋嘅專業人員。醫生助理同執業護士通常都係接受一啲同醫生相似嘅培訓。我哋個個都係碩士級以上，甚至乎博士級。
And I want to add one thing here. Of course, I'm biased. I'm a physician assistant. My passion is treating patients in rheumatology. I will say, find out if your office has a PA or nurse practitioner. Use us as your advocate. I spend most of my day educating patients. That is my passion. Usually patients that see PAs, nurse practitioners are highly satisfied. I know in our clinic model, the rheumatologist schedules are fully booked out for weeks to months, but sometimes I can make same day, next day availability for patients. You know, if you're having a joint flare, you need a joint drained or injected with steroids, I have you come in same day or next day and avoid sending you to urgent care or the emergency room. So please don't be afraid to use us as your resources and your advocate if you have not yet utilized APPs in your practice.
係啊，我身為醫生助理，可能有少少偏見，但係咧，我都好多時都係同醫生合作，幫助我哋嘅患者治療同埋管理佢哋嘅疾病嘅。我哋有啲咩可以幫到手咧？譬如喺我嘅診所入邊，我會為我個患者安排當日同埋第二日即刻嘅預約，患者通常會覺得好滿意。因為資深醫療專業人員傳統上都會花更多嘅時間去關注我哋嘅患者教育，呢個係我哋嘅首要任務，確保患者喺處理狼瘡方面嘅擔憂同埋得到聆聽、得到理解。因此，如果你冇試過接觸我哋嘅話咧，你哋唔使驚，下次試下同我哋傾偈。
And finally, just to recap here today, systemic lupus is one disease with multiple presentations and different manifestations. It can be very difficult to treat, often involving multiple medications that may have potential side effects. There's a multidisciplinary approach that is often needed. So you may see multiple healthcare providers, even across rheumatology, nephrology, other specialties. There needs to be a shared decision-making process, and you need to make sure, like Gabriella was talking earlier, about talking in depth with your priorities and sharing in that decision-making process for you and your journey with lupus. And again, I can't stress enough, the mental health aspects to support our patients with lupus is absolutely essential.
今日嘅結語啦，紅斑狼瘡係一個多樣化嘅全身性疾病，比較難醫治，通常需要多種藥物去治療。呢啲藥物有可能唔同嘅副作用。等資深醫療專業人員、醫生、藥劑師，甚至多個專業人士參加你嘅護理。重要嘅係，我哋同患者共同做出一個決策，咁樣我哋先至可以揾到一個適合佢哋生活方式嘅治療方案。佢哋可以持續性咁樣有效地同狼瘡相處。最後重要嘅一樣嘢就係心理健康。我哋十分支持我哋狼瘡病人各種嘅憂慮，呢個係十分之重要。唔好忘記，下次你哋有機會就同醫生助理、執業護士，佢哋係一個好好嘅資源。
And finally, we are on social media. You can visit lupusresearch.org, lupustherapeutics.org. Follow us on social media, Facebook, Twitter, everything.
係啦，你喺熒光幕見到我哋嘅社交媒體有唔同嘅推特、面書、Instagram。你需要知道多啲資訊咧，請你搜尋。
Okay, and I know we're running a little over time here, but I wanted to open the floor for any questions for Jennifer, myself. Floor is open.
How did you know you have developed lupus nephritis?
Good question. It's Cam, right? Okay. Question was, how do you know if you're developing lupus nephritis? In practice, and I will usually monitor patients a little bit obsessively every 2 to 3 months, usually with lab work. We are monitoring for kidney function changes and also specifically for levels of protein spilling out into the urine that would indicate a problem of filtration in the kidneys. So we were checking urinalysis for protein and kidney function on a regular basis.
有位聽眾問我哋若果有紅斑性狼瘡腎炎點樣醫治？通常我哋咧會2-3個月幫你跟進一次，要驗下你嘅腎功能，驗下你嘅尿入邊有冇蛋白質。
I will say I saw a patient yesterday in clinic, young lady in her early 30s, stable in remission on hydroxychloroquine for years. For the first time in years, we checked her routine labs. She had a huge amount of proteinuria. We caught it because we were monitoring regularly for the development of lupus nephritis. So lots of patients do not necessarily have hugely significant symptoms, but some of patients with lupus nephritis may notice increased swelling in the legs or even urinary changes, like in the quality of their urine.
嗱，通常咧腎炎
I had 2 hands here.
Let me translate.
Oh, I'm so sorry.
通常腎炎嘅患者冇乜症狀嘅，所以我哋定期檢查好緊要。好似我最近有一個狼瘡性嘅患者，佢好好食緊一個輕六貴藥，好穩定。佢入嚟做復檢嘅時候，發現佢尿液中有好多蛋白質，所以咧有陣時你唔知道自己復發，所以定期見醫生好緊要。
Okay, the lady in the back here. Great question. So hydroxychloroquine is considered standard of care. Unless you have an allergy to the medication or a side effect that's not tolerable, hydroxychloroquine is something that we maintain lupus patients on long term, and it is considered the first line treatment for lupus. So many patients, to answer your question, stay on lupus for decades. I'm sorry, stay on hydroxychloroquine, sorry.
聽眾啱啱問輕六貴呢個藥你可以食幾耐？Heather 小姐話呢個係一個一線藥物，非常之有效，而且副作用比較低，你可以食到你有反應為止。譬如你身體覺得有副作用嘅，到時再同醫生講。
Yes, ma'am, in the front here.
Hi, I'm not sure if you referenced it, but can you talk more about like having like protein in the urine?
Yes.
Kidney.
Yes. So when we are looking at healthy parameters for the kidneys, one of the things we're screening for is lupus attacking your own immune system, attacking the kidney organ system. And one of the ways we look at that is to get the filtration rate or the functional rate of the kidneys. That's measured by creatinine and eGFR in your lab sets. Okay. The other thing we're looking for is effect in spilling protein into the urine, indicating a problem with the filtration rate in the kidneys and things like that. And we screen the urine for what's called the protein creatinine ratio, or your nephrologist or your rheumatologist may ask you to do what's called a 24-hour protein collection, so they can look at that over a 24-hour period. Great question.
Oh.
Let me let her translate that first.
有位聽眾咧就關心點樣驗你尿入邊有蛋白質。咁除咗用驗血嘅方法睇下你個 creatinine 嘅比例係咪正常啦，睇下你嗰個沉降嘅速度係咪正常啦，嗰個腎小球嘅數量有幾多。咁有時咧亦都會用一個叫24小時嘅追蹤去檢測你個血液入邊嘅蛋白質實質係有幾多。
What was your other question?
Is there anything you could try to rectify or fix it?
Yes. So when we identify, I'll use my patient from yesterday as an example. When I notice an increase in the proteinuria in the urine or a change in their kidney function, we immediately will probably start steroids as our go-to option to calm down the inflammation going on. And then we have patients referred to a kidney specialist to consider a renal biopsy. Remember to identify the correct class of your nephritis, because that directly determines the most successful treatment options we should use. But taking medication for the treatment of lupus affecting the kidneys can often reduce that protein spillage, improve kidney function sometimes, but there are many patients with lupus nephritis. I'll use my patient yesterday as an example. She had not been to the clinic in more than 6 months, got frustrated with her treatment regimen, stopped all of her lupus treatments. Luckily, she was feeling fairly well, but decided to go ahead, come in and see how things were going. Her only symptom was fatigue. She had no other symptom to identify that she was spilling a large amount of protein and lupus nephritis was active at the time.
好啦，呢個朋友問，咁若果你發現尿液有蛋白質點算啊？ 咁啊 Heather 小姐話，第一我哋就會開一個皮質類固醇同你去撳住佢，跟住咧有可能會轉介你去腎科醫生做一個腎活檢。剛才我講過，我哋好緊要知道你嗰個腎炎個級數去到第幾層，咁我哋先至可以用適當嘅治療方案俾你。想話俾大家聽咧，當你個腎有事嘅時候，有啲人會有腫啊、水腫，但係好多人咧都冇咩症狀。我最近有一個病人6個月都冇嚟睇我，佢一嚟睇我咧，發覺佢尿液入邊有好多蛋白質。問佢，我感覺唔到乜嘢喎，只不過最近有少少疲倦。嗱，所以呢個咧，我想請大家留意啦。
We're having questions that came in online, so I'll take a moment to answer some of these. Nothing come in recently. I had a couple that were submitted prior to the presentation that I just wanted to touch on. These were questions submitted online.
我哋網上有人問問題嘅。
One of the questions was something about lupus after the age of 50. And I will say, in general, we have about 10 to 20% of our patients who are diagnosed with lupus after the age of 50. But in general, the course of the disease tends to be milder. Oftentimes, if you are older at age of diagnosis, those who are most heavily hit with with earlier diagnosis and more severity of disease, oftentimes are our young women, African American, Asian American, Hispanic Americans of childbearing age.
OK， 網上有人問50歲以上會唔會有機會有狼瘡啊？其實50歲以上咧都有機會，但係可能個症狀會比較輕微。我哋大部分發病嘅年齡就係15至45歲生育年齡，佢哋嘅症狀好明顯係比較嚴重啲。另外咧，頭先講過亞裔人士啦、非裔同埋西語裔咧，都比較容易有呢個症狀。
I think Cam had a question.
No, I just said,
Okay.
I'm one of those.
Yes, ma'am.
I'm sorry. So much credit. 有人咧就將嗰啲尿咧儲埋咗日幾，咁咧就睇下，原來有啲就有一層色嘅喺下邊，係咪就係太多個？
蛋白質。Oh, you know someone who has accumulated urine for a day, 24 hours, and discovered there are some white substances at the bottom of the liquid. Is that protein?
Not necessarily. There are many things that can be collected when you're not necessarily doing what we call a clean urine catch, okay? You can have skin cells and other things in the area that collect that as a sediment. The best thing to do is have your person that you know go to their medical provider and ask for a laboratory urinalysis where they can direct them to have a clean process of catching urine and analyze it thoroughly in the lab.
個朋友問佢有人儲咗一日嘅尿，底下咧有白色嘅物體，係咪蛋白質 ？Heather 小姐話未必，有可能係細胞，有可能係血球。最好咧，佢提議你去揾翻你嘅腎科醫生做一個正式嘅腎功能檢查。
因為呢個係我去旅行去咗內地睇到有啲人。
Oh, I see.
Just 1 second. I was going to say we are out of time for the main program, but I want to thank everyone for coming.